Hello, everyone. Thank you for joining us today. We're real excited about our hot topic. It's one that has interest both by men and women. Today, we've got Dr. Ben Kirbo joining us, as well as Leslie Lewis. Leslie is a medical assistant. She is Dr. Rosenberg's nurse. She is here today because Leslie is involved in all hair restoration procedures. I'm going to take a deep breath. I'm going to start all over. Leslie is here today because she is involved in all hair restoration procedures, from the actual procedure to post-op. So she can answer a lot of questions that you may have about the post-op and the recovery process. We really encourage viewers to share questions. You can send them in by Facebook. Leslie's going to actually be monitoring these questions, and she will be sharing them with Dr. Kirbo, who will answer them. So let's get going. Today we're going to discuss hair restoration, and for me, my eyebrows. Men and women have other aspects of hair thinning. There's just a lot of questions there. So we offer a lot of types of hair transplants here at Southeastern Plastic Surgery. So Dr. Kirbo, talk to us a little bit about some of the reasons people are seeking hair transplants.
Well, I think the main reason people are seeking hair transplant is because they identify themselves with their hair growth, which they have, most of their early life. And with people living longer, with some medical treatments, hormonal treatments that may interfere with hair growth, and traumas and other incidents that can affect hair growth, as long as genetics, people are seeking it out. And with some of the newer technologies and trends we have today, we've really been able to replace hair loss in a natural appearing way, which has been something that has been different in the past. Now, if you look at some of these slides here, we can divide reasons they do it under the specific reasons, but male pattern baldness or hereditary balding is the most common reason we are seeing hair transplantation. This can be in women and men. The male balding pattern or balding in female is often a genetic disposition that comes from both the mother and the father. We all begin to lose hair as we age, but about 40% of men and women as they get older, especially women after menopause, will have enough hair loss that they will be concerning. So genetic pattern baldness is the most common. Now, many of these issues are combined too, because with the male pattern baldness is usually associated hormonal issues or a inability or oversensitivity to different hormones. So they're sort of combined together. So we can sort of, for me, group male pattern baldness and hormonal changes as the most common reason for hair loss. We are seeing an interesting new pattern of hair loss in some of our different patients related to cultural hairstyles, weaving, tight weaves. In those middle pictures, you can see a patient that we're seeing these days where this patient has lost a lot of hair along the area of a very tight and weaves, and this can begin to cause the hair to atrophy and thin. And then we do see female pattern balding. Again, this is typically after hormonal changes in menopause, but I would also sort of categorize this as genetic as well. The interesting thing about men and women is men lose their hair in a typical pattern with the temporal area and the crown, whereas women tend to lose the hair from the crown then down toward the middle, almost like in a Christmas tree type appearance. But hormonal changes and the genetics are really the most common reason we see hair loss.
So, Dr. Kirbo, how do you know if hair loss is due to hormones or heredity, or is it?
Well, I think you can almost assume it's a little bit of both. Remember, hair loss is not a scalp issue; it's a follicle issue, and so genetics may interfere with the follicle's reaction to a distant cousin of testosterone, and this sensitivity to this hormone will cause the hair growth span to be shorter and shorter. The hair will become thinner and more fragile until ultimately it stops growing. But really, those two, I think, can be combined. Now, there are other hormonal diseases or hormonal changes such as hypothyroidism that can lead to hair loss in people, but generally that can be reversed many times once the hormones are um, are corrected. But genetic and androgenic, as it's called, hair loss related to the sensitivity to this type of testosterone, that is not reversible with medicines or changing the hormone presence.
Leslie, do we have any questions?
Yes, I do have a question. This one comes from Leslie Phillips. She wants to know, how long will it take patients to see the results from hair restoration?
Well, I mean, typically we have to see these hair follicles grow through a cycle. So when we're talking about hair transplantation, you're probably going to begin to see some growth of those hair follicles in a 3 to 4 month period. And then those hair follicles will continue to thicken and grow over the first 6 months to a year.
Okay. And we have another question coming in. This one is from, she's got a mouthful, Amy Beckwith Tillman Jordan. Are there tests that show a predisposition for hair loss? I guess saying, like, is there any, like, blood work that shows the hormone imbalance? I guess that's what she's asking.
Well, not really. I mean, you could do genetic testing to look at some of the sensitivities to some of those hormones, but it's not like you can replace that particular hormone. Like I said, it's a cousin of testosterone. Men and women both have it, and it's related to the sensitivity of the follicle to that hormone, which tends to be more of a genetic predisposition. Therefore, the genetics and the hormonal balding are really sort of the one and the same.
Okay. Well, let's move on and let's discuss FUE.
Well, when we're talking in this particular talk about hair transplantation, and there are two basic methods that we provide for hair transplantation. People who have looked at this or read about it will understand the strip method and or FUE method. And they have generally two distinct populations that we use these different techniques for. Both are techniques that transfer follicles that are not sensitive to the hormones we talked about, usually from the back of the scalp to the areas where the follicles have become sensitive to this hormone. And so FUE is just a technique of this transplantation of these follicles. We, in the past, always had to do a strip type technique where a strip of hair was cut out from the back of the hair-bearing scalp and then closed with suturing. So any kind of hair transplantation would leave a scar on the back of folks' head, which some people didn't like, whether it was sensitive. FUE is a way we use a device to actually harvest those follicles without doing a long strip of cutting the skin out. Therefore, you don't end up with a scar on the back of the scalp from the donor site. The FUE method generally is used for folks who don't want that scar, or people who we don't need to have as many follicles for the transplantation. If you look at this patient here, had a very high forehead, and you can see some of the more frontal scalp hair loss. That's before on the left, and then you can see the regrowth of those follicles through a FUE transplantation. Now, I think that is done very well for this patient, but it's probably not quite as thick as we want it to be, and probably with a single strip procedure, that hair growth could be thicker. They may want to go back now and do another FUE transplant to add more follicles rather than doing it all in one with a strip procedure.
Dr.
Leslie,
I have a
you have any
question.
more?
Sorry,
You have-
Lily. Hold on.
You have any more questions?
Yes, I do. So we have a question, and the question is, how do you know which technique fits which patient when they come in? Like, what makes them a candidate for which one?
Well, I think some of that has to do with the patient's choice. You can use the technique on either on any patient, either technique. Some patients are very adamant not wanting a scar on the back of their head, and then others may not want to have an area that has been shaved on the back of their head, which is required for the FUE. But in general, I feel that when someone needs a large volume of follicles in one sitting, that the strip procedure may work nicer. We can harvest and use more follicles, do a larger amount of grafting as compared to the FUE, which may require multiple procedures to get the desired result, as opposed to one procedure with the strip.
Mentioned about the large volume need versus not quite so large need. Which procedure provides more grafts?
Well, the strip procedure would require more, would provide more grafts, and because these are each follicle is actually harvested once the strip is cut out. The strip is then cut almost like a bread loaf, and then each individual follicles in 1, 2, and 3 groups are harvested and placed in position. So with the FUE, it's a device, and you can only harvest so many follicles at a time because you're doing it without leaving any kind of scar or any area that needs to be closed with any suturing.
Okay. So hair transplant can restore hairlines for many different situations. Dr. Kirbo, can you go over some examples of the hair transplants done at Southeastern Plastic Surgery?
Well, since I've been talking so much, I'm going to let Dr. Rosenberg do that. I just joined us. So I'm going to let him do that for us and go over some of those procedures.
Thank you.
I think go ahead.
If the frontal hairline tends to have the best results for hair transplant. So if someone has had surgery and has an area where their hair is thinned, or if they just have natural male pattern or female pattern baldness, which is much more common than a transplant, can work well. This lady here that you just brought up, interestingly, she came and her only request was that she knew she would always have to wear a wig if she went out, but she didn't want to wear it at home around her children or grandchildren, but didn't want them to always comment on how little hair she had. So, she was a tough one, only because women, you can't always get the same density that they want. Men are willing to tolerate a less dense frontal hairline after a transplant. They just don't want to see their scalp as much. Women tend to really want a high density transplant, and that's just not always possible. But for this lady, it accomplished her goal. She felt comfortable enough at home, answering the door if someone came in to deliver a package. And in her case specifically, that her grandchildren were visiting, and she didn't feel like she had to wear a wig around them. And yet they wouldn't comment on that she has no hair on her head. Other time, can you hear me?
Yes.
Okay. Other times that I think hair transplant works extremely well, especially in women, are for brows. Uh, a lot of women will go and tattoo their brows, which can be problematic as they age because sometimes that skin drops and then it doesn't look right. Or you can just, styles change on how they want their brows done. And brow transplant, I think, is a way underutilized but highly effective form of hair transplantation that a lot of people don't even know about. This was a lady who had a what's called a bicoronal hair transplant elsewhere. And if you look really carefully, you can see her scar, especially kind of at the above those two temporal apexes right here. And she just wanted that scar covered so that people wouldn't notice it when she had her hair after she had her hair transplant, when she would pull her hair back in a ponytail. And there, I think you can just see that the hairline now covers that scar. This is another lady with the same problem. A visible scar after surgery done elsewhere for a brow lift. And she just didn't like that her scar was visible when she had her hair pulled back. This is an example of someone who just wanted a fuller hairline. He's a man in his middle 60s, a businessman, and he just didn't like that when you looked at him straight on, you could almost see the crown of his scalp, and here he is shown before and after with a nice improvement. He certainly should expect to have more growth, and sometimes people do actually need to do or would benefit from a second transplant. I always tell patients, especially young men who are early in the hair loss but don't even want to have a phase where a lot of their scalp shows, that they absolutely have to be prepared to do a second hair transplant because their natural male pattern baldness is going to progress and it's going to continue on, and you'll have to then fill in those areas, or you will have areas where your scalp is showing. It's another guy with bitemporal hair loss, and you can just see him before and after, just, how nicely it filled in. If his hair loss continues, he is another gentleman, maybe when he gets into his 30s, will need a second hair transplant. This is another gentleman, didn't need a big transplant. It was a small one, but he just didn't like how he was starting to thin up in the temples and just wanted that frontal hairline made stronger. This is the same, just another man who was in the early phases of hair loss, but didn't want to have his temporal hairline climb and just wanted to strengthen the front of his hair so that when he wore his hair parted to the side or when he was swimming, that his hair didn't look extremely thin. This is another gentleman who underwent a hair transplant. We really focused on the front of his head, which you can see, but also we had some to get to the crown. The crown tends not to have the best density effect because of its surface area. It's just a figure of geometry, but you can fill in better in the front of the scalp and less well at the crown. And so your biggest bang for your buck is the front of your hair. That doesn't mean we can't do the crown, but you're not going to get the same density. But I think you can clearly see just how nice the front of his hair is filled in, and even towards the crown, and he certainly would benefit. And in fact, he underwent an additional hair transplant not too long ago. This is brows. This lady just didn't like her thin brows, and she had a brow transplant. The procedure takes about an hour to an hour and a half, and then you can just see before and after. Now, you do have to, manicure your brows because the hair will grow long if you don't, but you can just see what a nice fill-in this was for her, and it just helped her because she really didn't want to get the tattoo because she just didn't like the way the tattooing looked. And here's another gentleman who almost has no brow beforehand, and then you can see him before and after with a brow transplant. Works really well, and patients really like it.
I believe, Leslie, we have some more questions.
Yes, we do. I have two questions from Christina Rummage. And her first question is there an ideal age to a hair transplant? Either doctor.
You want to go, Ben?
Yeah, I think the ideal age to get a hair transplant is when someone is wanting it, and understanding, as Dr. Rosenberg pointed out, that pattern of baldness may continue. So if someone has a male pattern of baldness and they have climbing of their temporal scalp, and that's filled in with time, they may begin to see some thinning of more of that temporal scalp higher up. But to me, the time is when they feel like they're ready for it. I don't know if you have a different answer, Lawrence.
No, I mean, very similar. I just tell them if it's bothering you enough to go ahead and do it. I do think for me, there's a point when they're too early and it's not worth it. But aside from that, when it's bothering you enough, as long as you're prepared that you may do a small transplant the first time, but down the road, you may need a second transplant or even a third transplant, depending on the progress of your hair loss.
Okay. And then the second question from Christina is, what is the downtime after a hair transplant? Either or, whether it's the FUE or the strip.
Leslie, why don't you answer that? You're the one who's taking all the phone calls. And
Touche, Dr. Kirbo. Well, the FUE, the downtime it's much easier because they don't have a strip, so they don't have as many restrictions as somebody that has the excision in their back of their head. Because with that, you have to really take it easy for about 10 to 14 days, because that's how long the sutures will be in. And we encourage that they wash and clean back there to make sure there's no scabs or dried blood, and to, apply ointment. So usually it's, about 2 weeks at the most.
But you would remind them with the FUE, they may have an area of shaved scalp.
Yes, but yeah, they still have restrictions, but not as rigid as, for the strip.
Yeah.
So downtime may be also related to when they can not wear a cap or
exercising. Mm-hmm. Yes, absolutely. Because you have to worry about bleeding and swelling with both of them, but a higher risk with the strip, of course, because you're actually excising. Mm-hmm. Oh, I have one from Shauna Marie from Facebook. She says, is the FUE or the strip more popular? So I guess which one's more popular? I guess she's asking.
For me, I don't know that one's more popular. It's what suits the patient. I always tell my patients that if you don't mind if you're never going to shave your head bald ever, then I would do the strip, because as Dr. Kirbo said, you can get more hair grafts from a strip without a doubt. If you think one day you would shave your head bald, if your hair continued to lose it or your hairstyle changed, then to do the FUE. And that's kind of how I break it down with patients. As people get older, I think they benefit much more from having the strip than from the FUE.
Okay. Dr. Kirbo, how long can you expect a hair transplant to last?
Well, I think the good news, if you're truly moving those follicles from the hair growing posterior scalp into the area of no active growth, you can really expect a hair transplant to last a lifetime. Now, you can still have hair loss and progression of hair loss, but I think most people find that with that transplantation follicle, it will go now into sort of the normal life cycle of a hair follicle. Now, it can thin and a little bit in over time, but I think you would see most people will have a lifelong improvement of that hair growth.
Oh.
Okay, I have another question. This one is coming from Miss Stephanie Daniels. She says, I'm afraid I missed the comments about the use of hormones for thinning hair. Would you please discuss it again?
Well, I think when we were talking earlier, I wasn't really discussing use of hormones for hair growth, but hair loss is related to hormones, most commonly in hair pattern baldness or hereditary baldness, related to sort of a cousin of testosterone that the follicle becomes more sensitive to that, and the follicle lifespan or growth span gets shorter and shorter. Now, there are other hormones that may affect hair growth, or hormonal imbalances such as hypothyroidism and that type of thing. But I don't know if I have much comment on the use of hormones systemic for changes in hair growth. Do you have any comment, Mark?
No, other than, I always talk to them and make sure they're euthyroid, that their thyroid is normal, because that can be a big source of hair loss in an unsuspecting hypothyroid patient. And I do find that women, as they age and go through menopause, their hair tends to thin a lot more. Right? They have less estrogen, which tends to be protective. And so then they can go through the same phases that men do. It's, often less talked about, but it is a significant problem for women. A sizable portion of women, as they age, will have thinning hair.
Well, let me jump in. Maybe another good question. Nobody's asked it though, but I think a lot of people want to know, once you get a hair transplant, what's the maintenance? Like, how do you keep it full? Like, how do you kind of, even though it's hereditary and hormonal imbalances, but I think a lot of people want to know, what's that magic pill, if there is one, to help once you get the hair transplant to maintain the fullness?
I don't know if there's a magic pill.
No.
than healthy living,
Yeah.
And, but it's all related to the sensitivity to those hormones that are really a genetic, disposition. So
What about like the shampoos like Rogaine and that? Does that help? I mean, I guess it wouldn't hurt either, but.
So I think that there's some shampoos that can help, and I usually, we usually give those, recommend them to the patients. Some of the shampoos that help with cancer patients can help the hairs grow in quicker. And then there's some shampoos that just can stimulate the scalp, but nothing is truly effective. In terms of maintenance of the hairs, you don't have to do anything. If you want to reduce your risk of losing more hair, Propecia is an oral medication that you can take. It was originally developed for male prostatic hypertrophy, or just an enlarged prostate, and they noticed it allowed people to grow hair. So there is a pill you can take. It's a lot lower of a dose, but it's not without its potential issues. Some men say it gives them erectile dysfunction, and so it's just something that you can take. But like anything, there's no magic pill. Everything has a plus and a minus.
So we've talked a lot about after the hair transplant. Is there a success rate that you measure in terms of hair transplants? What's that?
For me, the success rate is the patient happy. I mean, it's very hard to count follicles. You can usually tell when you look at the hairs. The transplanted hairs tend to look a little bit thicker where they come in, because usually where you lose your hair, it's a little thinner. And so you can tell when the hairs are growing in. For me, it's just, is the patient happy or are they not? That's a great question. I wish there was a good way to truly know how many grafts took and how many didn't. I guess you could get out a magnifying glass and do it. It just wouldn't be easy. It wouldn't be easy.
I think just a point to follow that up is a lot of the success is probably related to the techniques used and who's doing the hair transplantation. So I think it's important to make sure whatever facility or practice or physicians you're using and their technicians, that they're experienced and where to place the grafts, the hairlines, and their techniques they're using.
That's a great point.
Okay, I have one question so far. This one is from D. Mayfield. How soon can you go back to work after a hair transplant?
I tell patients it depends on what you do. If you can wear a cap to work, I usually tell patients you can have it on a Friday and go back on Monday. If you can't wear a hat to work and or you feel uncomfortable in front of your coworkers, then it's going to be about 7 to 8 days off of work. And so to me, it's just what area of work you're doing. If you're do maintenance or something that you're lifting lots of heavy things with it, then again, it's going to be a little bit longer, like 7 to 10 days. If you do more of a desk job or something where you're not exerting yourself, 2 or 3 days off and then back to work is very reasonable.
Were you going to say something, Dr. Kirbo?
No.
Okay. I have a second question. This one is from Adrian Griffith, and she wants to know, is there any truth to stories that wearing a ball cap can cause baldness?
Well, I mean, you can certainly, hair loss can be related to trauma or straining, like we see in some areas where weaves are very tight and pulling, or it can be related to trauma such as after burns or where skin grafts are required. But just wearing a ball cap, I would say no, there's no truth to that.
I have a question. How does insurance deal with this? Does it pay for hair transplants?
I'll let Lawrence answer that.
I have never had insurance pay for it. I'm sure that if you had like burn related alopecia, or one of that, those type problems that created your baldness, then certainly it could be a discussion to have with your insurance company. There's certainly a CPT code for it. And therefore it's a possibility. I think a lot of it would just depend on how you develop the hair loss and then, who your carrier is and whether that's something that they want to cover.
Okay.
That's a great question.
Lastly, do we have any more questions from the audience? I'm looking. Let me see if there's any that I missed.
The audience can continue to send in questions privately through our messenger or on our Facebook page. We'll also have this hot topic on our website, on our Facebook page, as well as on YouTube, so you can share it or watch it later. If there are no other questions, I would be remiss if I didn't share with everybody that this weekend we're celebrating our 20th birthday, anniversary, whatever you want to call it. And I'm really excited to share that the practice is offering 20% on all of their products. And so, ladies, men, now is the time to do it. If you have any more questions confidentially that you don't want to send through emails or Facebook, don't hesitate to pick up the phone and call and talk to one of our cosmetic coordinators. Thanks everybody for joining, and we will be back the end of next month, and we'll share that topic with you shortly. Take care and have a great weekend.
Thanks.
Thank you.